Hi, I'm Shelley from AgriHealth. Diane and I have set up Mastatest online mastitis testing. We've taken a sample, we've run our first test, and now we've received back our first report by email. This puts us right at the forefront of mastitis testing and treatment recommendations worldwide, with a 24-hour solution pioneered right here in New Zealand. Now, we're looking at interpreting the results and deciding how to treat. To assist me in interpreting, I've invited Steve Cranefield, our mastitis expert, to join us. Thanks for coming out, Steve.
No worries, Shelley. Knowing the bug is key to using the right drug, and that's what today's all about. So, Diane, what have we got on the report?
It looks like the first part of the report shows us the bacteria that is causing this cow's mastitis.
Yeah, that's right. So the first thing we've got is the bacteria, and the next thing we've got is a ranking of the antibiotics.
Is that what this number means?
Yeah, it's called an MIC, the minimum inhibitory concentration. And that's really just what amount of drug is required to kill the bacteria. So the lower the number, the more successful it's going to be at killing those bugs. You see they're ranked in order. So the one at the top, that's the antibiotic that the bacteria are going to be the most sensitive to, and it's the one we recommend. So know the bug and know the drug, and you'll know exactly which antibiotic to use. It's really that simple. Now, just a few other things about the results to bear in mind. So Diane, do you milk your cows once a day?
No.
No worries, because if you did, some of the drugs that come back in the report may not be suitable, and we suggest that you talk that through with your vet. So what's the result come back as?
It's come back as Staph aureus.
Well, that's important to know. Has she had mastitis before?
No.
Well, that's good, because Staph aureus can be quite difficult to treat, so we may need to use an extended course of the antibiotic that's recommended on the report. And remember, if there's any doubt, check with your vet. If this isn't the first case of Staph aureus for the cow, check your records. Look for repeat high somatic cell counts or repeat clinical mastitis cases. It may be that this cow needs to have the quarter dried off, be treated with dry cow antibiotic therapy, or perhaps the cow should be culled. A couple of other things to note. Your test might come back saying contaminated result. If that happens, it's because 3 or more types of bacteria were found, so it's likely something got into the milk sample. The first thing to look at is your sampling technique. Maybe the teat wasn't clean enough, or you've accidentally got dirt or muck in the sample. So you should take another sample from that quarter and test again. If it's a gram-negative infection, it's likely that all of the MIC scores will be above 4, so antibiotics probably aren't the answer. These cows should be treated with pain relief, such as Ketamax or Maladine. And finally, remember, if you're in any doubt, check with your vet. Well, Diane, that's it. Knowing the bug and the right drug to treat it is going to give you the best result, and no more guesswork. I know it's going to be a great thing for your farm, and it will be for your farm too.